Hey everyone, thanks for checking out my channel. In this video, we're going to go over sciatica. What is it and what can you do to treat it at home? Sciatica is irritation of the sciatic nerve. The sciatic nerve comes off the lumbar plexus in the low back area, comes down the back of the buttock here, travels on the back of the leg, all the way in the foot and the toes. This can be caused from typically three things. There are other causes, but typically the most common three things that I've seen are from disc herniation, where the disc material comes out, touches the nerve, spinal stenosis, where there's narrowing around the nerve from the spine. That can be from arthritic bony overgrowth or bone spurs. Then also it can be from piriformis syndrome. The piriformis muscle, we have one on each side here, and that can become tight or that can compress. If it spasms, compress the sciatic nerve and cause these symptoms to radiate down your leg or towards the lumbar spine. The first thing that we want to do is a sciatic nerve floss, or just mobilizing the nerves. What you're going to do in the seated position, we're going to say that the symptoms are radiating down my right leg. So what you're going to do is you're going to kick out the knee, straighten the knee out, bring the toes back up to you, and then you're going to look up towards the ceiling, and then you're going to look down. As I look down, my knee and foot is going underneath me. I'm pointing my foot down. So my toes are pointing down, my knee is bent, and I'm looking down. Then you're going to go back out, straighten out the knee, pull the foot and toes back, look up towards the ceiling, and then back down. You're going to repeat that for around 10 to 20 repetitions for a couple of sets, a few times a day. Next is going to be the cat-cow movement. I really like this movement in the seated position because I feel like that it really just kind of gets everything to move in the lumbar spine. So what you're going to do is you're going to sit in a chair nice and comfortable. You're going to round your shoulders forwards, kind of hunch over like this. And as I hunch over, I'm kind of tucking my pelvis in. That's the cat position. Then we're going to go into the cow, where I'm going to look up, pull my shoulders back, create that extra sway in my lumbar spine, so that curve, and then kind of poke my butt out as I go back, and then I'm going to go back around again, round forwards into the cat position, and then come back into cow. Repeat that for 2 to 3 sets of around 10 to 15 repetitions. Next, we're going to perform the prone cobra. So what you're going to do is lying on your stomach, you're going to push up. As you push up, look up at the ceiling, and then come back down, push up again, look up at the ceiling, extend the arms all the way, and come back down. Repeat that for 2 to 3 sets of around 10 to 12 repetitions. Next, we're going to perform a loading strategy. So what you're going to do is take a kettlebell or a dumbbell. We're going to perform what's called RDLs. So you're going to put your feet just whatever feels comfortable as far as shoulder width, and I have my knees slightly bent, and then I'm going to bend forwards, keeping my back nice and flat, just a little bit, and then come back up. And as I come up, I really extend my back, a little hyperextension of the back there, and then I come back down. Now I'm keeping this weight close to my body. I don't have it out here. I'm keeping it close to my body as I go down. So I'm going to go down. Now, if you start to go down too far and you feel that electric shock or the symptoms get worse, just don't go as far. You could even take the weight away, and initially, instead of using the weight, I usually have patients just kind of clasp their hands together, and they just kind of work on that movement without any weight until you feel the control with it. You have the good body mechanics with that. Repeat that for 2 to 3 sets of 10 to 12 repetitions. As it begins to feel better and you feel pretty confident with that RDL, then you can go into a squat. So I'm going to take the same kettlebell. You can use dumbbells, holding them by the side, that's fine. Or you can use a kettlebell, just kind of whatever you have. We're going to work on just really a partial squat or a mini squat initially. So what I'm going to do is I'm going to hinge back, so push my butt back, bend my knees, keep my back flat, and then come back up. So push back at the hips first. I'm pushing back, bend my knees, come back up. And you can work towards a deeper squat and a heavier squat, but initially just perform that for 2 to 3 sets of 10 to 12 repetitions with a partial squat, and then working towards a deeper and heavier squat. A great way to work on a little soft tissue release, or just to kind of calm things down a little bit, you take a tennis ball. I'm going to put that right over my glute area where that pain's traveling down. I'm just going to lean over and just sitting on that tennis ball. So all that I'm doing is putting the tennis ball under the glute. I'm sitting on it right there just statically. I have patients a lot of times just at home while they're just sitting around, just use the tennis ball. A lot of times that helps because of that pressure in the area to kind of alleviate the symptoms and just make things feel a little bit better, so you're able to tolerate your exercises and your movements. Our last movement is going to be a stretch. So if you don't have a strap, you can use a towel, pillowcase, just kind of whatever you have. What you're going to do is try to flatten down the knee. So I got my knee flat and I'm pulling the strap back. I have it here at the ball of my foot and I'm pulling back. Really feel that stretching on the back side here. Now, if that's too much, too aggressive, you can't really tolerate that, you can take the strap away or the towel away and just work on a knee to chest stretch, holding it just like this, and then go to the other side and holding. I typically have my patients, if we're going to stretch one side, do something on one side, or even nerve mobilize on one side, I usually have them do it on the other side as well. I feel like if it's good for one side, still good for the other, doesn't typically hurt anything, so I definitely would do both sides. Thanks so much for watching. I hope this video helps with your sciatic nerve pain. Be sure to hit that subscribe button so you can stay up to date on all my content.